Good afternoon. I'm Dr. Sandra Martell. I'm the Public Health Administrator for Winnebago County, and today I'm joined by Mayor Tom McNamara from the City of Rockford. I'm going to focus today a little bit on actions to combat the resurgence of COVID-19 and give everyone a little background information. When we talk about our region, Region 1 includes Boone, Carroll, DeKalb, Joe Davies, Lee, Ogle, Stevenson, Whiteside, and Winnebago. The metrics that were put out 2 weeks ago, when they started to look at what would we do if there was a resurgence, and how would we look at the numbers. There has to be a sustained increase in a 7-day rolling average. I know there's going to be a lot of math in this, but basically over a week, do we continue to see an increase in positivity? Do we also see an increase in hospital admissions or a reduction in hospital capacity, where we have less than 20% of our hospital beds available? In combination, those might cause us concern about how do we implement some additional tiered approaches to the resurgence. There's also, if we do a 3 consecutive day averaging greater than or equal to 8%. So when we look at these metrics, we begin to be available on the website, what we report every day. It starts to tell the picture of when do we get concerned that the COVID-19 is resurging in our community. We're in phase 4, but what does that mean when we start to get increased cases? As of today, which is August 2nd, Region 1, which includes all of our counties, has had 5 days of positivity increases. But the good news is our hospital admission rates and availability continue to be stable. However, on Friday, we received notification that Joe Davies County in our region was at a warning level for COVID-19. Their current case rate was 150 new cases per 100,000, and according to the state, the target is 50. But I don't want Winnebago to think they're resting easy. We were at 61 for that same time frame. Their positivity rate was 11.3%, which was over the target of 8%. But our positivity rate was 5.2% as reported on by the state. This increased positivity rate and the increased number of cases were related from travel to and from hot spots or areas where there was increased case activity, such as Iowa and Wisconsin, and larger social gatherings. We look at each other and we figure out how do we move together to best keep our positivity rates low so that we can continue to begin to restore and recover from COVID-19 in our region. So if we continue to decline, it's called a tiered response. I often hear, are we going to go back to phase 3? Well, technically, we're not going to go back to additional social mitigation strategies. For instance, would reduce indoor dining capacity, reduce elective procedures in our healthcare systems, limit social gatherings further, decrease room capacity, and decrease organized fitness and gym capacity. We continue to have positivity rates that increase and new cases arise and our hospital capacity gets stressed. We'll be suspending indoor dining, suspending elective procedures, suspending organized recreational activities, limiting to non-essential retail, and limiting personal care. If things continue to further decline, we step into what's called Tier 3, where we go into that strictest kind of restrictions possible. Limiting gatherings and room capacity even further, remote work for non-essential, limiting to outdoor recreation only, and personal care based on outbreak status. So as we look at this, and we were put into a warning status by one of our counties on Friday, we need to be continuing to work together because we don't want we want to continue to really expand. And remember, we're all working toward the goals in the fall for some form of in-person learning. And that gets jeopardized each time that positivity rate increases, or each time that we continue to have sustained positive increases in caseload. So again, it's incumbent on all of us to recognize, well, one in our region struggles. We are not out of the zone, so to speak. We need to work together because we really succeed and fail as a region at this time. Part of that tiered response. The goal is to continue with our current activities. Continue to update our travel guidance, recognizing that people do travel at this time of year, but understanding you may be going to areas or spending time in different ways that we want to make sure protects our community from the transmission and spread. Masking. I don't know how many more ways we can say it or how many different ways to wear them, but masks that cover our nose and our mouth. Not chin guards, but real masks. Continue to take it outdoors as much as possible during this beautiful time of the year here in our area. Limiting group size. I often hear, well, if I have 3 groups of 50, right, I can have an event that's 150. No, there's an intent and a reason. We're really reducing that capacity and crowd size. And of course, we talk incessantly about hand washing, frequent sanitizing of touch surfaces, and staying home when you're sick. But these are the actions that we have so that we do not need to put more restrictions on our reopening or stepping back in those tiered approaches. We also learned over the weekend about tests conducted from July 12th through July 24th, that including some of our pop-up test locations and our University of Illinois Health Sciences campus, that we're using a laboratory called Raditis, in which there were some issues with reporting of results. This is not the same laboratory that we had issues with earlier in the pandemic on the testing. And so again, we're very disturbed about this. It is unfortunate, it's regrettable, but it's not within our control. And so we as a community need to continue to move forward. Please call the hotline if the state confirms that your laboratory test was compromised. Seek additional counseling regarding repeat testing, because you may be out of the zone at this point. If it's been more than 10 days and you had signs and symptoms of illness, is it necessary to test? If you're in a quarantine period, we'll go through and advise you in the best possible way that we can so that you can return back into your environments as quickly as possible. So either release you from isolation and or quarantine. And I remind employers to work with the health department regarding the use of tests for return to work. We're seeing a lot of individuals being told that they should serial test to return to work, or that they need multiple negative tests to return to work, and that is not advisable under current guidelines. If you have concerns about your workforce environment or individuals returning or that need to be tested, please consult with us and we will provide you the best guidance we can. We don't want to stress and undue burden a testing system which, when there is large capacity concerns and issues, often has issues with reporting. We want to make sure that our residents who need testing, get their accurate results back in a timely fashion so they can take the appropriate action and we can conduct our contact tracing. So that was the information we learned over the weekend. I also get a lot of questions about, you are our partners with the health department. I see given by non-health department personnel about testing, about when you can return to work. I've heard all kinds of stories about, I can't come back until I've had 5 days of rest and I've had a negative test. I want to advise the public that we are the experts in this area, and we will work with employers, we will work with schools, we will work with daycares to make sure that they have the most up-to-date and current guidance so that people who do need to be isolated or quarantined are appropriated and or quarantined for the proposed amount of time that's required, and then are returned appropriately so that no one is disproportionately burdened by inaccurate or incorrect information being given to them. Reminder that you cannot test your way out of quarantine or isolation. So oftentimes I hear, well, I'm just going to go get a test and I'm in quarantine because I came back from a vacation hotspot. You cannot test your way out of the quarantine period. And ill individuals, regardless, are required to isolate for a minimum of 10 days and 24 hours of being absent of a fever without fever-reducing medications. So it's as if that testing can provide you with a kind of get out of isolation or quarantine. And the reason for that is, remember, not every test is 100%. Test results may be delayed. Quarantine or a test at any point in time is a test in time, and we continually have to remind individuals that the testing technology to date has not changed significantly in that. So you can't test your way back out of quarantine. Last week was busy. We also heard that all sports policy was released on August 15th. Sports were classified as high risk based on their contact, such as high contact sports for things like football, wrestling, hockey, competitive cheer. Medium were things like basketball, volleyball, and paintball. Lower were cross-country, crew, gymnastics. And the level of play is determined again by the level of metric in our community. So I come back to, if you want to get back into competitive sports and play, if you want to return to those activities, we're all going to continue to have to work to make sure that we're not having to put tiered mitigation in place. So level 1 is the most restrictive. That is training only. Think about when we first started back up, it was the most restrictive. Level 4 is when we're talking about, it's the least restrictive. That's where we can do tournaments and out-of-state competition and return to our big, regional competitions and things that traveling teams can go to. So within that, there's a lot of variability. But again, within that response, we want to be able to make sure that we're in a tier 3, right? We know that tier 4 is going to take us a while to get there. But we want to be able to do play within our communities, regional athletics, play within our state. We really need to continue to work on those metrics. In the current recovery phase, for low risk levels, they can play at levels 1 through 3. So nobody is at level 4 where we're doing out-of-state tournaments, we're inviting other states in our region to play. It's in-region play. Medium risk are levels 1 and 2. So you start to see a little less ability to kind of intermingle teams, again, because of the exposure. High risk is only allowed to do level 1 now, which is conditioning and training. So I know that's a lot of risk, a lot of levels, a lot of tiers. And unfortunately, I wish we could say we all had the same language, which would make it easier for the public to understand. But the idea being that we really want to be able to be mindful of those activities that, again, have the greatest risk of helping us to spread the virus. We need to then begin to stand back, walk back, make sure that we're putting things in place so that we can enjoy a sports where we can go out and play. Baseball has proven to be kind of a challenge at the major league level, but not at the local level. We were able to have a lot of seasonal play still going on. We had some tournament play within our region, which again allowed for individuals to get out and enjoy the summer weather, get children out to play, get people out to watch their families in appropriate ways. But again, we've got to make sure that we are being mindful of those crowd gathering sizes and those activities that put us at risk for transmitting the virus. So wearing those masks, frequent hand washing and sanitizing, and keeping that group size to a cohorted amount, a small group size that we know who's been exposed then in the event of a potential case of COVID. The governor today announced a new campaign. I'm sure you've all seen it, masking. It only works if you wear it. So here's my mask. It's similar to seat belts, life jackets, helmets. And again, I remind everyone, we are all in for Illinois. We have fought way too hard, and we are all in for 815. We have worked very hard to keep our infection rates low, to be able to reopen our businesses and return to some degree of normalcy during all of this in phase 4. We don't want to have to step back in a tier or become more restricted. Our goal is to continue to remind everyone of the importance of masking. And again, it only works if you wear it. We need to continue to protect our lives and our livelihood in our region. So new numbers for today, 14 cases. Our total cases are now at 3,669. And we do a 7-day rolling average positivity rate, which is calculated based on the numbers we have in hand in this health department about all of our test results, and our positive test is at 3.9%. 96% of our individuals have recovered or been reported as recovered. Unfortunately, though, we have one new death to report, bringing our total deaths to 115. And again, every death is a concern for us. When you look at the number of our residents and community members throughout the United States have died, it's the size of many of our cities and communities. And we would not want to lose any more. We have no new locations of concern to report. So with this, I want to remind everyone again, as we look at our region, as we look at their state, as we look at those numbers, it is in our control. And again, wearing a mask is one way that we can help protect our community. Because again, we don't want to step back. We want to be able to then move forward and continue to be able to expand and look forward to opening of the schools for some in-person learning environments, some school sports where, again, important social emotional learning can occur. Next week, we plan to have representatives from our school districts speak about all of the plans that they are making to help bring children back into the educational system for a blended, remote, in-person learning, and how they see the school year shaping up as we approach that. So with that, I'd like to have Mayor Thomas McNamara step up to the mic and for his remarks.
Thank you, Dr. Martell. Again, appreciate your leadership and certainly appreciate most recently all the mobile testing sites, pop-up testing sites, if you will, that is improving the much needed access to testing for everyone in our community. It's kind of hard to believe that we are now coming up and marking the 5th month that we've been doing this together, and I would share some of the sentiments that you stated, probably nicer than I will, regarding I don't know how many different ways we can say some of the same things to you to ensure that all of us are playing our role as one community team. A tremendous thank you to those residents who have done the good work and been vigilant and played that role of wearing the face covering, washing the hands, cleaning the frequently used surfaces, taking events outside, practicing social distancing. A huge thank you to them. A big thank you to the businesses. Since just over the last couple of weeks since businesses joined us, I'm not aware of a business in the city of Rockford that has been fined. They've all been heeding the incredibly strong guidelines to make sure that employees and patrons are wearing them. So just want to say a big thank you to our businesses as well as citizens. Again, I'll just close out my comments on COVID-19 by simply wear your face covering. It protects others when you wear it. It benefits all of us when everyone wears it. Next, I just want to touch on 2 quick topics. One is the census. We are now below the state average for completing the census in our community. We need to increase our numbers. It is incredibly easy to complete your census. You can go to my2020census.gov, and it is incredibly important to everyone who calls Rockford home that you complete the census. 2 huge areas that it has an impact is on our representation in Congress. We know right now that we are bound, the state of Illinois is bound to lose at least 1 congressional district. If we perform poorly on the census, we have the potential to lose a 2nd seat. That would be devastation to our state of Illinois. Second is For every single person who fills out the census, your community, if you live in Rockton or you live in Roscoe, your community receives $1,560 per person, and that is consistent for the next 10 years till we do the census next. And so one person completing the census in your community is the equivalent of $15,600. That's a huge impact on your local area so that we can provide critical core services. And if those who don't complete the census, we still need to provide those services. So I'm urging everyone, take the 6 minutes it takes you to complete the census and wear your face covering. The last item I'll say is we are obviously still challenged in our community with domestic violence. Survivors are still looking for hope at every corner that they turn to, and I would just want to remind folks that we are taking appointments and have been taking appointments for the last 2 weeks at the Rockford Family Peace Center, and you can visit our website at rockfordfamilypeacecenter.org, or you can call them if you are in crisis or need, and you can call them at 779-34600. That's 779-348-7600. And with that, we'll take questions.
Dr. Luttrell, I have a question for you regarding Winnebago County. I understand right now none of the other surrounding counties are on that level yet. Why do you think that is, and could that change pretty easily moving forward?
Well, I think I was, and the question was, do I have, first of all, we've been in communication, our region, we talk, and Joe Davies was the first county, but I was very upfront with all of you that it could easily be any of our counties. And again, part of the case investigation, the contact tracing that gets done for the cases when there's increasing positivity, identified travel to hotspots, as well as larger social gatherings. And so again, when you look at Winnebago County, we issue travel guidance, not to restrict people from traveling, but to understand what are the things that we're going to expect when they return so that they do not transmit the disease in our environments.
I have a couple questions about the tier system that you started with. Not the sports one, but the first one we were talking about. Are these county or state kind of, is that how these tiers will kind of be enacted and set out?
So the question is about tiers and how they're set up. And first of all, it's the state framework, Restore Illinois, and it's almost like a matrix, right, of kind of where you're at. And again, we begin to look at what do we need to do. So outbreaks associated with food establishments, bars, right, become that tiered approach about how do you restrict capacity. You saw some communities throughout, various areas may restrict beaches if that's where a gathering place occurs. You might begin to take a look at if we continue to have community transmission, where are the areas that we see people congregating that we really need to step back and say that capacity is too large and we need to begin to put some additional mitigation back in.
So I guess to clarify, it's not everything's at tier one, like some things can be at tier, not on a tier, some things can be on tier one, some things can be on tier
Correct, and it will be done in partnership, as you would understand, with the Illinois Department of Public Health. I mean, is it an absolute, is it a checkbox that said these are the things that must occur in tier one? It is a tailored approach, and again, the idea being, though, you begin to start to look at restrictions so that we can, one, really reduce the spread and transmission. Two is to preserve hospital capacity if that's one of the concerns or issues.
So there is no hard and fast level, this is what gets restaurants into tier one restrictions, or this is what gets, you understand.
No, if you do this, there's no absolute. And so again, it's kind of, I don't want to call it a cafeteria list, but a list of different social mitigations that you would put into place if your community transmission rate was high.
Okay. I have a few questions about a large gathering. I'm sure that you've probably heard of a large event that took place at the Rockford Speedway over the weekend. Mm-hmm. You said one thing in particular, and it was like you can't have 3 groups of 50 people, and say that you're fine. There is one thing in particular, the Illinois guideline is 20% of grandstands can be used for outdoor events, correct?
That's correct.
The Rockford Speedway told us that there was some sort of negotiation, I beg your pardon, that they could have 28%?
All right, so let me be clear about this. We were not aware of any event at Rockford Speedway that did not comply with the DCOE guidance and their plan with us to open up the speedway for races. In conversation, we reached out and said, obviously, we saw it as well. We received complaints from the community who said this event makes us uncomfortable. And we understood that it was an outside organizer that put that event on. And again, we are working with our businesses to say, look, it becomes very important. We'll support you in what we are working with you to do. But you also then need to make sure that you are, if you have an event that's occurring in your location as an outside organizer, that you need to hold them to the standard. Because at the end of the day, we are responsible for making sure that we are all in this together. Because again, I come back to, it wasn't an issue. We got reports that people felt uncomfortable with the amount of crowd size, masks not being worn, the parking lots were full. And so I think, again, I come back to that would not be something we would ever endorse or support at the health department.
I think you bring up something in there, is that it's on the organizer to make sure that, you know, these events stay within guidelines. And you mentioned something right there, masks and then the collections of people together, because obviously with a certain capacity, you're able to spread out and, you know, conduct outside events well, but at this event in particular, there's video and pictures of people like clumped together and not wearing masks. And when we spoke, said, well, we can, you know, say, you know, wear your mask and don't congregate as much as we want, but it's up to the individual. Can you kind of give, you know, clarity as to, and I think you got at it a little bit already, is that it's really on the organizer, you know, whether or not to do that and enforce these policies that we've been given by the state and by the county.
Correct, and make sure they have the necessary security to make sure that if they need assistance with that. It's disappointing. It puts our community at risk. I would guess that many of the individuals who came Winnebago County. And so, again, I come back to this is a venue within our county. I'm going to say organize it, have another organizer that comes into the event. I hold them accountable for that event.
So the quote that we got is, we can't make people do this. Is that an acceptable, I guess, deference of responsibility?
Is that, the question is, when someone says, we can't do anything about that, is that acceptable? And I would say, it is not acceptable and it's not responsible.
A couple of questions on contact tracing. Maybe asking more simply for an update. You got the grant, almost a month and a half ago?
Well, we heard of the grant. Funding came in. We are working on the interview process, and we have people in the pipeline. Our goal is to have mid-August people starting.
So no one has been hired as of yet?
There are offers in what we call in the queue. So
okay, got it. So it just contact tracing. This is something we maybe have covered in the past, but so how exactly do they know who to call? Does that info come from Illinois Department of Health or the county?
what will occur is that we talked about these data systems that we have where a positive test result, we'll start with a very basic kind of positive test result comes into the health department. Let's say it's my name. A contact investigator, a case investigator will contact me and say that they've received a positive test result of COVID-19. Chances are, and hopefully, I've received the same test result from my provider, and I understand that. And they'll ask me about 8 hours, where do I work, what's my work like, do I wear masks, was I in 6 feet of social distancing, and that's how that begins that process. And so through that, they may find out that I might have 5 or 6 people that they need to then get in contact with, which is the contact tracing next step, to say you've been exposed. Obviously, they can't, will not identify who it is. But if it's a circle of friends, I want to say to people, they probably know you know each other, and they would say you've been exposed, and here are the necessary things that you need to take over the next 2 weeks, that we need you to monitor yourself and quarantine for that 2-week period.
Got it. And then I think this is a clarification of what exactly their job is. They are just they're only calling people who have been exposed to people with COVID-19. They're not calling to tell people whether or not they've tested positive, right? So the investigator will, right? I mean, I'm hoping that that is not the first conversation. I'll be honest with the public. I mean, if you're going to your doctor's office, maybe you're having a test done for a procedure. Oftentimes we hear that their test result comes into their electronic chart, their provider will call them,
and then the health department will notify them. If you're calling the number from one of our testing sites, they should also be then telling you that the health department will be following up with you. For individuals, they use the term state health department, local health department interchangeably, but it's based on your residence where you live. So if I'm in Joe Davies County, I'm a resident of Joe Davies, then Joe Davies County will contact me. If it's Winnebago and I live in the city of Rockford, then Winnebago County Health Department will be contacting me.
We touched on venues. I wanted to switch it over to protests. Is there any sort of enforcement when it comes to large gathering at protests for mask enforcement there?
Once again, we come back to, you have not seen us, and nor have we stepped forward with policing our way out of the pandemic. So again, we do education on that. Most of our protests that we've seen, I'm going to say recruiting individuals to come and protest on a particular issue, matter, or concern, have been told to bring a mask and that they will practice social distancing. We consider that to be supportive and knowledgeable about the understanding of how the disease is transmitted. When you're going to an event, so if you're purchasing tickets for an event on some place that you want to go, look to see what their websites say. You know, are they saying that, you know, we require masking? You will be assigned a seat. You are to come to, you know, to the particular area where you're to assign. If you're supposed to come in through gate 2, you come in at gate 2 at your assigned time with your family or household, and you come into the venue. But at the end of the day, I come back to, people need to do it because it's the right thing to do. I think many of our protest concern groups have identified that they are populations at risk and have worn masks and encouraged their participants to wear masks.
Ms. Lilly, I have a question regarding the tests from July 12th to the 24th. Did you say that those tests were lost or they were inaccurate, or what was the problem with those?
I'm going to pull that up. What we understand is that there was a test processing delay for approximately, from the state, according to their news release, processing of up to 3,800 tests from the mobile sites. And not just the mobile sites in Rockford, they were throughout the state, including St. Louis, Peoria, Bloomington, Aurora, Rolling Meadows, and South Holland. So they're across all of those locations. So when a test specimen is taken and they say there's a delay in processing, if a machine goes down, that specimen may be too old for them to process with the reagent, and therefore, but I do not know the specifics on that, but that's a general concept of why sometimes things get delayed and then they're not adequate for specimen testing.
Okay, so that might have been then 3,800 people who didn't know within a 14-day or however long it might have been span if they had it or not?
I'm sorry, I don't understand the question.
Yes, so let me rephrase it. So that could be 3,800 people then who did not get their results?
They will get a result that says it was unsatisfactory and that they should either, one, resubmit a test. But we've been talking a lot to individuals about why did you go for testing? Now we know that some employers have said you need to test, or other individuals said I wanted to double check. We had some serial testing. We said, okay, if it's been 10 days from the date of your last symptom and you have not had a fever, again, you're released from isolation. You can test, but you may start another period then of isolation, because we know these test results, based on the literature to date, is that you will test positive for an extended period of time.
One more COVID-related question on my end. You started this by saying Winnebago County is not out of the woods, and even though we like to probably distance ourselves from, mentally from areas of like high concentration, like Joe Davies County is recently, is it fair to say though that cases in our region, Region 1 in Illinois, are on the rise in general?
Yes, and again, the question was, are cases in Region 1 on the rise, as they are throughout the entire state? And so that's why we get the warning, so that we can get out there and remind individuals, take a look at what else we can do to help encourage people about social distancing, wearing of face coverings, especially, and I want to remind our community, we have schools that are starting throughout this region in a couple of weeks. And so if we are intentional, if we want to bring our children back to some in-person education environment, if we rely on our school to help us provide some childcare in addition to education so we can go to our jobs, we need to be thoughtfully working through that.
We have a question from our W2AD TV from Iowa joining us virtually today. They ask, you mentioned when one county struggles, we all need to step up to make sure our region doesn't slide back a phase. Can you remind people that the disease doesn't stop in the county line? Is Joe Davies County a warning to the rest of the surrounding area?
The question is Joe Davies a warning for the surrounding county? Absolutely. I think all of us understand that. Is that, first of all, as a region, we share hospital and healthcare resources, which is why these regions now are identified. And so again, when we talk about our capacity to care for, it's a sign, especially for those of us who border state lines, that people do travel and people do come across. The disease does not know boundaries. And it really doesn't even know states, as we know. It only knows when people come together, they're in large gatherings, and they're not wearing face coverings.
Non-COVID related, I have a few questions for you, Mayor McNamara. Obviously, a very busy weekend in Rockford on a lot of different fronts. Initially, what I want to ask about is, over the last couple days, yourself and many others have voiced the concerns over comments made by one of our representatives, John Cabello. I think just in general, how important is it for city officials and representatives, officials just in general, like how important is it, should they be mindful of what they say and how it could be possibly taken out of context in different ways?
So the question is, how important is it for city officials, can I broaden it and just say leaders, or
Sure.
Actually I'm going to broaden it and say everyone. And I'll put myself in in the category of always learning. Right now, with what is going on across the country, but right here at home in Rockford, it is incumbent on all of us. That's every single citizen. That is you as journalists and newsmakers in our community. Everyone needs to be mindful of what you're saying and how you're saying it and the impact that it can have. Right now, we have a huge need to fill this massive void in our community of those kind of threads of the fabric that bring us together. And there's a number of them that bring us together, and those are the areas that we should be focusing on because that'll bring us together. It doesn't mean that we're ignoring either side of the issue. It's just meaning we have to get together so that we can collectively face these issues. So absolutely, every single person, especially elected officials, I fail at it all the time. I think many of us do, but it's incumbent that we always work to do better when we know better.
You took to social media and said that most disturbing, you read disgusting comments and personal attacks, people who are kind of debating online. Can you take me through why you consider that to be one of the most disturbing things right now?
So most disturbing, second to most disturbing, whatever, I wouldn't rank it, I probably shouldn't have. Again, there I go, making comments that may heighten something. What I would say is, folks on both sides have been receiving just really disgusting, very personal slamming attacks on individuals. Not about the issue, not about the policy or the protocol or the law, but about themselves as people. And I don't think that advances any of our cause as a community as we work really hard to move through what is really a difficult situation. Again, I too falter there. I think we all do at times, and it's easy to go down that path. But I would say it really is disturbing when I have conversations with some I agree and some I don't agree with. But if it's folks who are protesting against police brutality, the fact that they are getting threats to their livelihoods or their lives, that's not acceptable. And the opposite side, if you want to be the most ardent supporter of whatever it may be, and you're getting threats, that's not acceptable. We're above this, Rockford, and we need to be above it, and that includes myself. I'm not saying I'm immune to it. I'm just saying when we know better, we need to do better. And right now, Rockford, we know better. We know that what we say matters, and we know that what we say needs to be bringing us together, focusing on the huge monumental tasks at hand.
You mentioned personal attacks. Are there any people in particular that you think?
I'm not,
would be attacked?
I'm certainly not going to call out their names yet again, because that'll more than likely ignite further attacks on them. They know, those who are making the attacks know, and those who are receiving them certainly know, and it all has to stop. We cannot tolerate intimidation of anyone in our community.
You mentioned that a lot of these attacks are because the focus is no longer on the issue. I guess kind of going back on the issue within that comment you made over the weekend, you were talking about some things you bring forward to City Council this evening. Kind of take me through what that discussion with Alderman is going to be tonight.
So I would also just say the question is, what is, you started off by saying that now seems like people are moving into personal attacks, and what's the discussion going to be at council this evening? I would just say a number of people are getting into personal attacks. A lot of people, a lot of really wonderful people are focusing on the issue. I don't want to paint a broad brush. I just want to highlight the need that we all are Rockfordians. We need to move forward together, and there's a respectfulness, even if you staunchly disagree with someone, that we should focus on the policies, the protocols, the laws, the actions or inactions, but not on the person. Discussion this evening at council. So this evening at council, we took a very initial steps right at the beginning in the immediate aftermath of the tragic murder of George Floyd. In that initial steps were we would start doing listening sessions. We would start the process of getting our Community Relations Commission to review line by line the excessive use of force policy, or our use of force policy, and also review body cameras. So the Community Relations Commission has completed their work and provided me, and now we've provided to the City Council a memorandum on body cameras, and that they do believe that we as a community should move forward with it. And so we will be reading that in tonight. It may sound more eventful than what it'll sound like this evening. I know you've been to a number of City Council meetings, so this evening it'll be just read in. Next week at committees, you'll start to see it be discussed, debated. I would say everyone that I've had the opportunity to speak with thus far is very supportive of body cameras. But understand, this is the very beginning of some of these discussions. There's a host of other issues that are coming to the forefront through these listening sessions. And so over the next several weeks, we'll be bringing additional items forward. And I would also encourage anyone who has additional ideas, you can email us at communications@rockfordil.gov. And I will also say, we're not going to stop listening. We're going to continue to do that, but we also need to continue to move forward so that we can have some much needed action that so many citizens and folks like myself are yearning to get towards.
You mentioned that this is the very beginning on body cameras specifically, so I know you're going to love me asking this question. Do you have any presumed timeline, or what's a perhaps goal, even if it's just Mayor McNamara, what is Mayor McNamara's goal as a timeline?
Yesterday. So the question was, what's the timeline and goal for body cameras? My answer was yesterday, somewhat jokingly.
I guess reasonable
Yeah.
in your eyes, or perhaps...
So now you're saying I'm not reasonable. No, good question. So I would say you're going to see council move pretty quickly. I obviously will never speak for them, but my gut tells me that tonight it'll be read in. Next week, you'll see the committee approve, more than likely. I don't want to speak for them, so any alderman watching, I'm not speaking for you, but I have a hunch that they will approve it and authorize staff to look for funding and also put out for requests for proposals. Then the very following week, it goes to council. My hunch says that there'll be some discussion, and then that item will be advanced further, and then we're going to get immediately to work. We don't want to wait. I mean, no one does. Awesome. Hope you guys have a great day. Good to see you. Thank you guys.
Are you okay with the Iowa group?
Yeah.
Okay.